A global pandemic at our doorstep.
We have confirmed our first presumptive positive results for the new coronavirus in North Carolina.
COVID-19 spread rapidly across North Carolina and the country.
I don't want to lose any more North Carolinians to this pandemic.
The virus changing life as we know it.
The biggest challenge was the emotional toll.
From the effects on the healthcare industry to education.
There were definitely some gaps post-pandemic in math and reading.
To long-haul health problems still being felt to this day.
We want a cure. I want to get better.
Spectrum News 1 is putting COVID-19 under a microscope to see the impacts it still has on our lives 5 years later. Thanks for joining us. I'm Rob Wu. 5 years ago this month, North Carolina saw its first positive case of the coronavirus. Today, our world is still dealing with many of the side effects. Here's a look at how we got here. According to the North Carolina Department of Health and Human Services, the very first positive case was announced March 3rd, 2020 in Wake County. Our state tracked more than 3.5 million cases before NCDHHS stopped updating its weekly totals in May 2023. As of today, about 37,000 people have died from the virus in our state. Over the next half hour, we're doing a deep dive into the lasting impacts. We'll explore topics from long COVID, the strain on the nursing industry, the push to return to office, and whether our schools have bounced back from learning loss. We have a team working hard to bring you this special coverage, including our Tim Boyum, Melody Green, Brittany McDonald, and Patrick Thomas. For many, the pandemic may feel like a thing of the past, but others are still dealing with its lasting effects on their health. According to the CDC, 1 out of 6 North Carolinians deal with symptoms of long COVID. It's an illness that can result in chronic conditions, sometimes lasting for months, even years. Our Spectrum News 1's Melody Green spoke with a mother and wife about her daily struggles all these years later.
I miss my career. I miss the classroom. I think out of everything, that's what I miss the most.
4 years ago, Brooke Keaton made the difficult decision to leave her career as a teacher.
It was, and still hard. I loved the children, I loved the families, I loved what I did.
Today, her life looks different because of long COVID. She uses a cane to get around and a stool to cook in the kitchen.
I never saw myself as being a housewife or house mom, and I still don't consider myself that. My day literally consists of trying to do things, but any time of the day that can just shut down. If I'm fatigued, if I'm in pain all the time anyway, but if it increases, I have to sit down.
She contracted COVID in December of 2020, then diagnosed with long COVID after months of symptoms and confusion about what was wrong.
I felt crazy. I felt like a hypochondriac because nothing made sense. Nothing went together. Prior to having COVID, I had just turned 40. I had lost weight, like it was all, 40 and fabulous.
Now she takes 8 medications and 1 shot daily. Brooke lives with an autoimmune disorder, brain fog, memory loss, a heart condition, asthma, and chronic pain.
It literally affected my body head to toe in different ways.
But she's found hacks to help her as a mom and a wife, like alarms on her phone and a large calendar.
The kids can put their chores on here. So I can do my meal prep. It just helps me keep everything together because otherwise I would forget all of it.
What's made things even more difficult is that Brooke's 14-year-old daughter also has long COVID.
It is hard because you never want anything to be wrong with your children. And I'm devastated. I am devastated. I am heartbroken, I'm confused. But I'm also determined.
According to the CDC, there's still a lot unknown about long COVID, including how many people experience it and why, which groups are disproportionately impacted, how new variants impact long COVID, and the role the COVID-19 vaccine plays with long COVID. But research is ongoing. In North Carolina, 1 in 6 people deal with the condition, and people like Brooke are advocating for more research and a cure.
We want a cure. I want to get better.
You talked about how your husband is amazing and your mom comes down here to Charlotte to support you. How has your support system really helped you as you deal with long COVID?
He is a walking example of our vows. In sickness and health, like, who would have thought this would have been, this would have happened?
Leaning on her faith also gives her the strength and the ability to see the silver lining.
I have met some of the most amazing people over the last 4 years. There are people that last year I physically met for the first time, and we have become family just in our battle to understand and to get better.
Brooke's story is a reminder that for some people, the effects of COVID didn't just fade away. Melody, thanks. As researchers work to better understand long COVID, the CDC emphasizes vaccination is still the best tool to prevent it. In that same vein, studies suggest certain medications may help reduce your risk. A report by the National Institutes of Health shows high-risk people who take the antiviral Paxlovid within 5 days of getting COVID-19 are less likely to get long COVID. Dr. David Wall with the UNC School of Medicine says even people who don't fall into the high-risk category may want to consider taking it as well.
If it does reduce your risk of long COVID, that may be all by itself a really good reason to get Paxlovid. So I talk to people about that. And I say, even if you're healthy and you're not at risk for ending up needing oxygen from COVID-19, you might want to consider this.
Right now, there isn't just one treatment if you have long COVID. It's recommended you talk to your doctor to figure out what options work best depending on your symptoms.
It was a very hard pill to swallow because I want the best for my babies, and our teachers do too.
The pandemic may be over, but test scores in North Carolina show there's still work to do recovering from learning loss. Coming up, the creative incentive one schools come up with to help students catch up. And after working years from home because of the pandemic, more companies are requiring employees to return to the office, at least on a hybrid schedule.
The in-office time, seeing coworkers, see people in the hallway, having those chats, having to stare at a computer screen all day, every day.
We explore the pros and cons and why some experts say this doesn't necessarily spell the end of remote work. Welcome back. The effects of the pandemic are still being felt in classrooms across North Carolina. Data released this year by the U.S. Department of Education shows a widening achievement gap between high-performing students and lower-performing students. Our Patrick Thomas shows us how teachers and school leaders are working hard to help students catch up and get back on track.
We're going to start with
Allie Sigler is passionate about teaching.
blending. So knuckles, please. So put it up.
We take all of our face-to-face time very seriously and try to make the most impact with the time that we have from opening of the day to close of the day.
In your head. Whisper.
The 2025 Cumberland County Schools Teacher of the Year
Out loud.
works with children who have social and emotional challenges at Elizabeth Cashwell Elementary School in Fayetteville.
A big part of our day is spent on SEL, social emotional learning.
Go back.
Imagine trying to develop these skills
Whoa.
without the face-to-face interactions you see here. Instead, development suffered because of remote learning caused by COVID-19. When students returned,
There were definitely some gaps post-pandemic in math and reading, and that comes from the fact that a lot of the strategies and the different learning styles that students have require a lot of hands-on and manipulative.
an education recovery scorecard released by Stanford and Harvard University shows 82% of students in North Carolina schools attend school districts
Job.
where average math achievement levels in 2024 were below 2019 levels. Statewide reading levels are even worse, with 97% of students at below average levels.
G and J. Okay. Soft G.
I found in life and in my reporting, children are far more resilient than people give them credit for. How resilient have you seen these children and other children to be throughout this time?
The growth that I have seen some of these students make from first grade to third grade or from kindergarten to second grade, it's an opportunity that not many educators get.
Current academic standards put students in tiers 1 through 3.
H, E-word.
A tier 1 student requires the least amount of intervention. Tier 3 needs the highest level of intervention through extra lessons and support. These students fall under Tier 3.
Education runs in my family.
Meet W.T. Brown Elementary School Principal Dr. Shanessa Finner. Dr. Finner's mom, sister, and cousin are all educators. The 2025 Cumberland County Schools Principal of the Year says many students feel behind because you can't teach who you cannot reach.
COVID created a lot of gaps.
Yes, it did, Patrick.
The same scorecard reveals the average American student remained nearly half a grade level behind pre-pandemic math and reading levels.
It was a very hard pill to swallow because I want the best for my babies, and our teachers do too, and the parents do as well.
Oh, is this the whole vault for the Cub Bucks?
You can find incentives like Cub Bucks at W.T. Brown Elementary, rewarding academic achievement using a rewards-based currency to pick prizes they want, plus a book vending machine. She tells me the biggest payoff is the influence of parents at home. Both Finner and Sigler see a light at the end of the tunnel. Sigler believes student growth will always be possible as long as education keeps rolling with the punches.
We're ready to meet the needs of our students no matter what comes down the pipe.
Those were some creative ways to try and keep students engaged. Patrick, thanks. In the story, you heard them talk about the importance of a strong support system around the students. The report card suggests more community involvement could lead to more classroom success, along with higher reading and math scores. The pandemic sparked another societal phenomenon, an epidemic of loneliness. That's according to former Surgeon General Dr. Vivek Murthy. A recent poll from the American Psychiatric Association finds 30% of adults feel lonely at least once a week. A sociology professor at UNC Charlotte believes COVID brought more attention to the issue.
We live in a productivity culture where people are admired and rewarded for their productivity. But the problem is that it masked the feeling of feeling lonely.
If you're feeling lonely, Dr. Smith suggests starting small, engage with the people around you, put your phone down during conversations, join a group that interests you, or try volunteering. When the pandemic first hit, many companies sent their employees home to work. Now many want them back in the office. A study on Resume Builder finds 1 in 4 companies will increase required days in the office this year, but also found 8 in 10 are losing some workers because of it. Our Spectrum News 1 anchor Brittany McDonald spoke with a North Carolina economist and a Charlotte area employee who now works a hybrid schedule to see how business has changed 5 years later.
Come on, Bailey.
Adam Reichenbach spends part of his work week at home with his fiancée Erica and their dog in their new house. For years during the pandemic, the manager of technology in the utility industry worked remotely.
I didn't have a desk for a long time, actually, probably a good 6 months. I thought it was all going to be temporary, and so I didn't go out and buy a desk. Well, eventually I bought a desk.
And now he's only back in the office a few days a week, something he says he was excited to get back to.
The in-office time, seeing coworkers, see people in the hallway, having those chats, not having to stare at a computer screen all day, every day, but actually able to see someone in person made a big difference to me.
But Adam is on one side of this debate, with some companies losing employees if they're forced to come back.
Many workers say no, they can be more productive outside the office.
Economist and NC State professor Dr. Michael Walden says the amount of remote work nationally has jumped from under 10% before the pandemic to about 25 to 30% now. And he says the benefits include cutting costs for businesses when it comes to overhead.
If you don't have as many people coming in every day, you don't need as much office space. You're gonna save money.
And for employees when it comes to commute and housing.
If you move outside of the big metro areas, what you'll notice is a dramatic reduction in housing costs.
When it comes to productivity, Dr. Walden says it varies.
Some studies have shown that there's actually no reduction in productivity. Others show, yes, there is. Some even show that productivity goes up.
Adam and Erica both say the collaboration and social aspect of the office is important, but agree things probably won't ever be the same.
But another 10 years, and it's just gonna be like, yeah, like our parents had to go in the office 5 days. It's just gonna be like it's bananas.
Some people enjoy the energy of the office, the face-to-face connection, while others like that flexibility of working from home, a debate that's not going away. Brittany, thanks. A recent article from the U.S. Bureau of Labor Statistics says some studies show remote work led to lower job turnover and higher job satisfaction, while other studies show productivity declined. Dr. Walden thinks this should be a business-by-business decision and believes we'll continue seeing a mix of remote, hybrid, and in-person workplaces for years to come. They were on the front lines, saving lives while facing uncertainty, exhaustion, and fear.
We didn't know what was coming, and we didn't know how to equip ourselves.
Now, 5 years later, nurses are still feeling the impact of the pandemic, both in their profession and in their personal lives. Still ahead, the emotional toll, the lessons learned, and how COVID strengthened their resolve to keep going. The pandemic impacted everyone differently, but it's hard to describe the extraordinary effect it had on healthcare workers. They were on the front lines, saving lives while facing the same uncertainty, fear, and personal challenges as the rest of us. 5 years later, their industry has changed forever. Our Spectrum News 1 anchor Tim Boyum spent time with several nurses to hear their stories.
It was just a big roller coaster. You didn't know what was coming.
2020, a year of uncertainty.
Overnight, everyone's life changed dramatically.
Perhaps no one's life changed more dramatically than healthcare workers.
We were just as scared as anybody else, but we showed up.
Each nurse with a different story, a story that still impacts them 5 years later.
The biggest challenge was the emotional toll.
The impact evolving the profession to this day, but issues still remain. In rural eastern North Carolina, Ashley Scholler faced the front lines of COVID right from the start.
I was actually the first night nurse that took care of our first COVID patient.
Scholler and millions of other nurses changing their work-to-home routine like they never imagined.
I took everything off. I had laundry sanitizer for nursing staff. That was a very hot commodity.
But the oddity of new routines paled in comparison to the gravity of what she faced in a rural ER.
We had 15 beds, and I remember one weekend I was working, we were all short-staffed, and our total number, which was the most in the hospital's history, we registered 142 patients on one day, and the next day was 144.
In Concord, Damola Ogunami started her career during COVID. She too remembers the challenges of separating work and home.
In the garage, we had this little storage area. I'd have to change in there just to make sure my family is not exposed to it.
Memories of isolation forever imprinted in their minds as patients nearing their last breath separated from family.
They felt that he would not make it out, and so I took my personal device in and let them, have a FaceTime whenever they see me. They thank you for that.
5 years later, it's the faces that stick with them more than the challenges they faced.
Just seeing them decline rapidly in days and then talking about end-of-life care.
The emotional toll, heavier than physical exhaustion.
We've been talking about burnout and psychological distress and those kind of work-related concerns for years and years and years, but all of a sudden it was just the spotlight was on. How are we keeping our healthcare workers, our nurses, everyone who's in the hospital together? How are we keeping them physically safe? How are we taking care of them mentally?
It's an issue hospitals are still sorting out 5 years later. Kara Evans trains new nurses and helps further their careers with Atrium Health. She's now Dr. Evans, and her PhD dissertation focused on that very issue. Early on during COVID, healthcare workers were hailed as heroes.
And that's well intended, but it also creates this expectation that you can continue to show up every day, but not need time to rest, to eat, to be with your family.
The pandemic also ignited a desire to have a bigger voice.
Nurses need to be involved in these decisions, that are shaping the care that we give. So I wanted to make sure that 100 years from now, there was some kind of a record.
In May of 2020, Kara Evans began her doctoral program, and her dissertation honed in on 33 interviews with nurses and their experience during COVID. Something for the history books, but also a moment of learning.
We didn't know what was coming, and we didn't know how to equip ourselves. Hospitals now are really investing in employee assistance programs and having more access to, therapy for their nursing staff and other things.
It's even more vital as another concern lurks around the corner. An NC NurseCast model projects by 2033 the state will face a 27% shortfall of LPNs, licensed practical nurses. They project 11% shortfall of registered nurses. Currently, about 162,000 RNs work in North Carolina, meaning the state could find itself about 12,500 nurses short. Ashley Scholler says there's not a single issue to fix the shortage, it's a number of factors.
I think pay is slowly catching up. One priority that is really near and dear to my heart is the fact that we have seen violence against nurses skyrocket. Unfortunately, we have had some North Carolina nurses suffer at the hands of patients, and they have become fatalities themselves. The day I got to see a discharge to home, getting back to their families was really awesome.
Those happy moments help carry these healthcare workers through the tough times. Despite the exhaustion, the fear, and even the violence, these nurses came out more motivated than ever.
Being able to rise above it all with my fellow team members has just renewed my sense of purpose within nursing.
A profession focused on what they do best, caring for others, now also focused on caring for themselves as well.
This story a reminder of the toll COVID took in so many ways, physically, emotionally, and mentally. Tim, thanks. While COVID led some healthcare workers to leave the field, as we just heard, it also reinforced the dedication of those who stayed. And that'll do it for our COVID-19 in North Carolina 5 years later special. You can find all the stories in the past half hour over on our website, SpectrumLocalNews.com. Thanks for joining us.